are likely to need acute care. Since we know that the rate of infection of this disease is extremely high, then what we want to do is to slow its growth rate in our population, because it will infect everybody unless you either have a cure or a vaccine or you lock people away forever. So even this business of lockdowns, in terms of a strategic intervention, a strategic question, it is not a solution. It is a buying time strategy. You put in lockdowns, you attempt to flatten your peak so that you can buy time to ramp up your facilities and your capacities to treat, your testing, your laboratories, your sampling, your social mobilization, your contact tracing, your beds. It buys you time to ramp up these things. It also buys you time to track and trace the virus. So you can do a lot of testing, you can do a lot of contact tracing whilst people are isolated. You also have a captive audience when your public is isolated. It's sort of locked down, which means that you can do intensive messaging to inform them and to do social mobilization to get them to take individual and community responsibility for the disease. The other big questions people are asking is, well, how do you get out of quarantine? How do you ease out of the COVID restrictions? Do you go from heavy lockdown to light lockdown, or do you go to slightly lighter lockdown? What is the metric that you would use?
Sorry, Obi, maybe before you go down to how to ease this lockdown, it will be helpful to also know some of the pros and cons of lockdowns, because across, even in Sierra Leone, that's one thing that a host of us, I mean, a good number of people have been clamoring. Oh, why don't you just lock down? Or what's the essence of maybe a 3-day lockdown? Why don't we have maybe a 2-week lockdown, or 3 weeks, or like 2 cycle lockdown? I mean, 2 cycles in the sense that we're being told that 14 days and then another 14 days. I mean, what is it? What really works in terms of pros and cons of lockdowns? That would be very educative for the people of this country also, and maybe for the government in terms of policy making. It has to be evidence-based.
There is no clear yes and no answer when it comes to lockdowns, because they have both positive and negative implications. Now, very rarely have I seen a lockdown, especially for the case of Sierra Leone, the couple of lockdowns they have been about 3 days. So I do not think those lockdowns have been done so that anybody who is infected with COVID will become apparent because they'll become symptomatic. As a strategic objective, I don't think that is very efficacious, because we know that over 80% of people with COVID don't have symptoms anyway. So locking them down, you might catch 20% that are symptomatic, or even less than 20% that are symptomatic, but the rest of the people will have it altogether. So when you look at some countries that have done short lockdowns like Sierra Leone, then the question has to be, the strategic objective of that was not to catch all COVID cases. The strategic objective of that was perhaps to slow the rate of infection with mass gatherings outside. It was also perhaps to give our government time to ramp up its capacity to do testing, to do contact tracing, and XYZ. Now look, the strategic decision to employ lockdowns has to be viewed from a cost-benefit analysis perspective. When you put in a lockdown, what are the benefits that you can get? Well, A, you can reduce the rate of infection, maybe. B, you can improve your case identification. C, you can improve your surveillance, your contact tracing, your testing, and all of that, finding the virus. And then D, as I said, you can do your social mobilization and all of this, and you can also ramp up your facilities. However, let's call that A. That's the positives of a lockdown. Now, the other side of the equation, you have B. B is the lockdown will have impacts on your healthcare system that are not COVID related. When you lock down, you will find that fewer people go to hospitals to use hospital facilities. There will probably be a drop in your use of ambulances. There would probably be a drop in people getting community care at home. And there would also probably be some impact, if you like.
Hello.
Yes, there will be an impact, if you like, on non-healthcare indicators. So introducing lockdowns has negative impacts on your wider healthcare system. You need to look at that. And then the C part, the third part of the lockdown equation, is that lockdown has a significant impact on the livelihoods of people in your country. We have a large amount of an informal economy with people who don't have salaried jobs, people who live by the day. So when you lock those people down, you have significant impact, not just on the economic activity around the country, but on their food security, on their economic security, and all of these. So if you like, when you are planning a lockdown strategy, you need to ensure that A is greater than B plus C. So the cost of the lockdown on your healthcare indicators and the cost of the lockdown on your vulnerable populations has to be less than the benefits, COVID benefits of your lockdown. It is very tricky. So what you end up having to do is, being aware of these negative effects, you start to design intervention strategies during the lockdown that will minimize the negative effects. For example, you start to ensure that there are clear pathways to move people from lockdown into Connaught Hospital via ambulance if they are sick. 117 is on point. It's taking people on, so you don't have such a reduction in the number of people using hospitals or a rise in non-COVID deaths because people are not going to hospital. You design systems and interventions to target the most vulnerable people in your societies. You look at urban dense populations, low-income populations. How do you feed these people? Do you do cash transfers? Do you provide them food? So, lockdown is not a one-size-fits-all. Many countries around the world. Thank you.
Yeah, thank you so much, Obi. That has been really very, very instructive. That's something I want to talk to Dr. Bell about from the medical perspective. Obi just highlighted that there are challenges in terms of, I think there was a drop in the number of visits to the hospitals and so on, use of ambulances. What would you say about that, Dr. Bell? What has been your experience? What are you getting even from the case management perspective as a member of the case management pillar of the response?
Yes, thank you. So in terms of the lockdown, absolutely spot on what Mr. OBCC has been saying, absolutely spot on. However, from the medical point of view, a lockdown of at least 14 days is what you do, don't say 21 days. Now, the question is, you have to, as he said, A has to be greater than B plus C. I think that was the equation, right? So, and unfortunately, that's not the case in Sierra Leone, which is why it was only settled for a 3-day lockdown. Now, before we talk about these other video details, lockdown and restrictions is fluid, okay? So there are still some restrictions in place. So that we don't have like this strict 3-day lockdown or lockdown when nobody goes out and all of that. But we still have restrictions in place, inter-district restrictions. And there are a whole lot of restrictions coming up as well, the mandatory wearing of masks. You have social distancing in public spaces and all of that. All of those are also going to be put in place soon. So yes, we're sort of fixating our eyes on lockdown, but restrictions, because remember, this virus is with us for a while. Not just for 14 or 21 days, but for a while. Nobody knows how long. Some people are saying a whole year, some people are saying 6 months. So this should become a lifestyle, how we do how we prevent ourselves from contracting COVID-19. So the aim was for a 14-day lockdown or 21-day lockdown is to get to the hotspots. Now, if you want to do testing, you have to wait for about 5 days. So if somebody has contracted the virus today, and you test that person today, the person is going to test negative. Okay? So if you test that person after 5 days, then it's likely that the person will test positive. So you don't want to test in 2-3 days. You want to wait for about 5 days, and then you start doing your community testing. And when you do your community testing, you can identify your hotspots, and then you can ease the lockdown in other areas of the country, and then keep those hotspots still under lockdown. Okay, so that's the idea from the medical point of view, added to all that Mr. OBCC has said. However, at the moment, the question is, do we still have hotspots, or is there widespread community transmission? So if there's widespread community transmission, then it doesn't really matter if we do it or not. But I still believe that we have hotspots, and it would be really nice to find these hotspots, lock them down, and so that we can contain the virus, one, and secondly, continue to flatten the curve, because it is all about flattening the curve.
Great. Thank you so much. At least we've got two perspectives here. We'll hear from Mr. Minister as a spokesperson of the EOC at some point. But Yasmin, as a human rights and gender activist, I mean, listening to this conversation, what's your assessment of the rights protection and promotion systems that we have so far in the midst of the COVID-19 situation? But also, it will be helpful to also hear from you, especially about the lockdowns and all that we've been talking about. Who's Yasmin? Oh my God! I think we lost our power. She just lost power at our spot at home. We're grappling with that, so I'm sure she will join us at some point. We just lost. Sorry about that. She will come back to us. But Mr. Minister, would you like to talk about the lockdown?
Absolutely.
What's your take on this? Mm-hmm.
Well, I think there's been serious examination of the lockdowns and how effective these ones are, especially for Sierra Leone. I think it's been an important tool, especially within the context of our public health emergency. But as Obi has said, there are implications that you also have to bear in mind, especially if we bring the example of Tumbo. With the incidents at Tumbo, what's the correlation between violence and any effect of the lockdowns, for example? What are the socio-economic variables that we have to consider if we have to think seriously about any future lockdowns? So, but the point is that there is a consensus that it's very important, especially for the inter-district lockdown, with cases now emerging in different parts of the country. And by the way, our cumulative now is 408, 21 new cases in the last 24 hours. So with all of that and additional cases emerging, perhaps the good point is the preponderance of cases point to quarantine. So the data is that we have a narrow scope for community transmission. But as we often say, and we are always advised by experts, no matter how narrow your scope of community transmission is, even if 1% evidence is there is evidence of community transmission. So we say to people that we will continue to have lockdowns for as long as they are necessary, and we say to people that all options are on the table. I see some countries like Iran is now easing restriction on mosques. I see Tanzania easing restrictions on international flights. And somebody says, well, at what point would the government of Sierra Leone consider easing restrictions, for example, on lockdowns? But I think early days yet. I think lockdowns continue to be an effective instrument in breaking the chain of transmission. I think we have to enforce lockdowns as much as we could. But there are lapses that we have identified. I was on 98.1, I think 2 days ago, and one of the 98.1 reporters, when he had a tip-off that some security personnel are compromising the security at checkpoints, he decided to also travel. This guy traveled, Joe, and came back, and indeed he played out the conversation he was having with the drivers. And one of the drivers was asking him to pay 100,000 leones. Why are you asking me to pay 100,000 leones? The driver said, well, because we have to go to some checkpoints and I have to spend some monies there. So it's the evidence is clear that security is being compromised. We have weaker parts of the chain. But by and large, the lockdown continues to be an effective instrument, especially if you look at Sierra Leone's unique facts and circumstances. And when we get to the point when we think it's necessary or desirable to ease lockdowns, I think that could be favorably considered at some point. But I think for now, it continues to be an effective instrument.
Right. Well, we'll still keep listening to the EOC to hear exactly what happens in the next coming days about measures that you're taking to keep us safe as a people. Until we get Yasmin back, Dr. Bell, looking at your work as part of the case management team, I mean, what have we done to prepare the health workers? Because that's also another very extremely important part of the response at the moment, because we know we lost so many health workers during the Ebola outbreak. So what's been done at the moment to prepare our health workers, to get them trained? I know you talked about the private health system, but also it's extremely important to know what's being done at the moment, especially as we open some more community care centers across the country.
Okay, thank you. Now, it is we all know that it is a challenge, that we have a challenge in Sierra Leone. We don't have enough. However, what is actually being done now is that we use the house officers and the medical officers that we have to help us work in these treatment centers. So we're also using the SCCHS and the CHOs a lot in these treatment centers. One major thing that was mentioned before, I think it was Obi that mentioned it, is that 80% of the COVID positive individuals are asymptomatic. They don't really need medical. All they need is a boosting of their immune system. Okay, so you don't need to have a huge infrastructure, a huge hospital in place to accommodate these asymptomatic and mild cases. So now the case management has put in place CTCs and CCCs. So CTCs are the treatment centers where you have the critical, the severe and the critical cases, and the CCCs are community centers where you have cases that are not that will contain individuals that are COVID positive that are asymptomatic, only have mild symptoms. Because these guys can walk around, you cannot contain them in one bed, you cannot contain them in one. So they recently, yesterday, they opened a CCC in Hastings, and that will contain up to 120 beds. They have a CCC in Fabi College that will contain 101 beds. And then we have the CTC at the 34 Military Hospital, originally 30 beds, what will expand in the near future to over 100 beds at the 34 Military Hospital. Two more areas in the hospital being used as the CTC. And also we have obviously the Jury Hospital with 100 beds as a CTC as well. So those are measures that we have put in place to sort of make sure our resources are used most of our resources used in the CTCs, and the CCCs, we can have them, but they don't need to have like your specialized medical personnel. They can do with your unspecialized medical. Training, as I mentioned before, all of these people have been trained even before we had the index case. We had doctors, nurses, CHOs, working in the private and public facilities that were trained on IPC measures, donning and doffing, how to wear a mask, how to remove a mask properly, how to wash your hands, how to practice social distancing, compartmentalization of hospitals to prevent cross-infection, etc., etc. So a lot has been put in place in terms of getting our facilities ready for this outbreak.
Great. At least we're making progress. But what about this? What about the regions? I mean, most of what you said, I heard a lot more about Western area, which is the capital of Freetown and its environs. So what's been done out of the capital or out of the Western area?
You're absolutely right, and I'm sorry.
Because now that looking at the number of cases now, we've got cases are all, I think 2 or 3 districts have been spared, but across the country we've got cases. The number of cases is really increasing rapidly.
Yes, you're absolutely right.
What do we have?
Sorry for leaving out the rest of the country, just concentrating on the Western area. So at the moment, in most of the areas where we have cases, 11. To bring up these areas into proper CTCs and proper CCCs. So that's ongoing. In a good number of districts, we actually have already established CTCs and CCCs. I cannot give you an exact number of what districts we have CTCs up and running fully, but it's a high number. And the few that we don't have them up and running, like Pujaon doesn't have a case yet, but we want to be ahead of the avalanche. So we've already identified somewhere to use as a CTC and CCC. We're waiting on looking up to partners to help us to bring up these structures to the standard where we can use them as CTC.
Great, that's very helpful. Obi, at the moment, based on your experience, could you give us like 3 or 5 lessons from the Ebola response that we might just find extremely important for the COVID-19 response team, as well as Sierra Leoneans across the board? Because one of the things that we keep talking about is the fact that there's a trust deficit. There's a trust deficit in our governance landscape. So most times, even when local leaders, local authorities talk to people, don't do this as part of the community awareness. People just say, okay, no, they've received money to do A, B, and C, so they don't really listen. But the fact that social contract factor that has been broken. So these are all challenges that people may have that are currently facing, or that we faced even in the Ebola response. So could you share 3 to 5 of your own lessons that might just be useful for us going forward?
Yes, thank you, Joe. The first and most important lesson is communications. More important than beds, more important than ventilators, more important than lab testing kits. The most important thing you need to end a viral outbreak is when people stop infecting each other. And people stop infecting each other when they are educated and when they take personal responsibility. When you look at Sierra Leone today, despite everything the government has said, I do not believe our social mobilization is landing yet. Because we still see people moving around without maintaining social distance. We still see people being cavalier about wearing masks. If you walk on the streets of Sierra Leone, there's very little that would tell you that we're actually facing an existential threat via a health emergency. So the people of Sierra Leone need to own this. For me, that is the first and most important element. Also, under communication, the response structure needs to communicate to each other. If one arm of the response doesn't know what the other arm is doing, it affects the efficiency of the response. If Dr. Bell is in case management and she's expecting patients, and patients have been tested positive for COVID, Dr. Bell should be one of the very first people to receive that result so that she can prepare the beds in the COVID treatment center for those patients. Dr. Bell, if she's treating a patient, must also be the one who decides when that patient gets tested and when that patient is to be discharged. The Honorable Minister, Jamiru, who speaks for the response, must have reliable information that he's able to tell the public about. If the Honorable Minister finds himself saying somebody died, and then he comes back again, enough respect to him for this, we have to congratulate the response for this, came back very quickly and said that person didn't die. Now, to me, that doesn't speak to whether the Honorable Minister was doing a good job. In fact, he did a fantastic job by coming up and immediately identifying the error. But to me, that speaks to whether the response is talking to each other. Who told the Honorable Minister that somebody died when they hadn't died? Was it from case management? Was it from this? So communication is about communicating with the public and communicating with each other in the response. Establishing what I call a ground truth on data. We cannot have WHO say you have this many cases, that person says you have that many cases, that person says you have this much in quarantine, that one says you have that much in quarantine, or you have a sit rep that says 8 people have been infected but 10 have recovered. So there has to be a ground truth on data. All of these things together come together to make the public trust you when you tell them something. So I think communication is absolutely key. After communication, I think information and communication, I think we look at the quality and the structure of the response. There has to be clear leadership and there has to be clear lines of responsibility. This is what we learned when we came on Ebola, because before we came, all of these problems I speak of were existing in the EOC. When we came, we sought to address them. There was a very clear line of control in the NAC. We had one final voice, and everybody who was an expert in the NAC, at least leading pillars, got to give an input before a final decision was taken. It was a collaborative process. We cannot have different ministries, departments, and agencies trying to maintain control of certain areas of the response. If there is an EOC and there's a response structure, everybody must second whatever capabilities it has to those people to be able to deploy them as and when the epidemiology demands it. When we came, we found that we still had certain ministries saying, this not me area, this not me area. No, you know they do this, you know they do this. Some people don't share data. Some people don't share information. Some people don't take clear instructions. So this doesn't know what that's doing. So the response structure and its communications has to be strong. The other thing I want to point out is the quality of the response. This is extremely important from my lessons I have learned. It is one thing to say we've got people in quarantine, but what is the quality of that quarantine? What are their names? What are their ages? Have they eaten this morning? Are there babies? Do they have baby food? Are there women? Do they have sanitary pads? Have their temperature checks been done? That has to be checked and verified on a granular basis, because it is because of these sorts of leakages in quarantine that you end up getting the virus jumping out of isolation and into the wider community. If you are testing samples, you need to have a clear turnaround time for your samples, and you need to make sure. Don't tell me all 100% of our samples we collected have been tested. I want to know how many have been tested and returned within 12 hours, 18 hours, 24 hours. Because I am going according to the guidance I've gotten from Dr. Bell in case management that says, I want my samples in 24 hours, I want my patients isolated, I want this, I want that, and we should be making sure it happens. So the quality of our response is my third point. Anything that we say we're doing, let's make sure we do it to perfection. You see, when they say to you, go and clean that bed, it's an Ebola bed. If you clean it and miss one leg and don't touch it, you come and say, I've cleaned the bed. But that bed is still infectious. Somebody goes on that bed, they will get infected by Ebola. And so the quality of your service delivery has to be extremely high. If you're doing social mobilization and sending social messages, don't just speak to the people. Do surveys like Focus 1000 just did. I think Dr. Bell mentioned that. To see whether the people are getting the messages that we're propagating, whether they're actually changing their behavior as a result. My final point on lessons learned is money, financial resources, and management. There's often inertia. We are not very good at unlocking money, either because we're not very good at preparing spending proposals and getting it spent quickly. So we often find that we have money sitting in the pot, and then you have complaints from frontline clinicians saying, we don't have this, we don't have that, we don't have that, but we do have the money. So we have to speed up the processes. It's a challenge for those involved in the response. On the one hand, you are getting demand for resources from the frontline, and you need to make quick decisions, which means that you often end up bypassing the normal procurement rules. But how do you do that and still be accountable for that money, dispense it quickly, and still be accountable for that money, so that you do not use the excuse of an emergency to do some things that are improper or to do anything that is corrupt? How do you release money quickly but also be able to account for it? It is a key part that affects, they say an army marches on its stomach. The response marches on its logistics. If Dr. Bell doesn't have her gloves, her PPEs, her hypertension medication, if she doesn't have her oxygen tanks filled up, these are problems that will have an impact on the rates of infection ultimately. So just to recap, communicate with the public well, communicate with each other well. Have clear response structures that are efficient and responsive, and check the quality of your responses. And then also make sure that your money is flowing and you can account for it and manage it.
Great, Obi. I think you highlighted a couple of key things that I want to go back to, and I hope Dr. Bell will help us deal with some of those things. Because we talked about training of health personnel, which is extremely important. I think they did it, but what's the extent of that training? That's something we'd like to know about a little more. I would like to probe a little more about that in terms of training for people in places like Bo, in terms of places like Kenema, and that have recorded cases in the last couple of days. I mean, the Honorable Minister just told us that we've recorded, I think, 20 or 21 more cases today. In the last 24 hours. So that's something I want Dr. Bell to speak to a little bit. But also in terms of the quality of quarantine and surveillance, where are we with that? What's the level of coordination or collaboration amongst the various pillars that we have? I think as far as I know, we have like 7 or 8 pillars in the response. So Dr. Bell, could you really elaborate a little more on the level of training, because that's extremely important in terms of IPC, infection prevention and control for the healthcare workers, but also in terms of even building their own confidence, their own self-esteem, in the response process. For quarantine and surveillance, those are also key in addition to the communication bit that Obi just touched on. But it would be helpful to hear from you, Dr. Bell, again, before I bring in the Honorable Minister.
Yes, okay. So there are two sets of trainings that we did in March, end of February and the whole of March. The one set of training was training on IPC and case definition of COVID. Those were done, that was done for everybody. And then the other set of training was the case management training. So that's for those that are supposed to be working in the CTCs. So those working in the CTCs and CTCs, they got both trainings. For those not working in the treatment centers, they got the training, the IPC training and the case definition training. So what do I mean by case definition? How do you recognize patients that are infected with COVID? What are the signs and symptoms? What is the case definition of COVID-19? It's fluid and it was changing all the time, so we had to be communicating different case definitions the whole of March until we had our first case, and then until we got community transmission. So we got representatives from the districts. So the national IPC have been quite active actually since March, and they trained individuals from every public institution in the country on case definition IPC, even before we had the first index case, okay? So these individuals were supposed to go back to their institutions, wherever in the districts, and then cascade. So this was a training of trainers that was done in March. And they were supposed to go back to the districts and train their staff in the various hospitals. And as I said, this was also done for the private facilities. We got 2 representatives from all private facilities all over the country. And unfortunately, a good number of them had to travel to Freetown for this training, but we did it over 3 days, and we had a good number of participants, 2 from each clinic on IPC. So how do you manage a suspect patient? What do you need to do in order to prevent yourself from becoming infected? Because you need that to be able to confidently treat any patient. So those are the things we taught them. They then went back and cascaded the training down to the other members of their team. So two trainings. One, IPC case definition for everybody. And secondly, case management for those working in the CTCs and CCCs. We developed an SOP for case management, which is an ongoing, a fluid document that keeps changing because of the different presentation of the COVID positive individuals. But we have a national SOP that we gave to all of these CTCs, and we trained them as well on how to manage COVID cases. Did that answer your question?
Yes, ma'am. Thank you. Thank you a lot. Well, we're happy to have Yasmin back. Yasmin, sorry about this break in transmission. Yes. Are you with us now? Can you hear me?
Yes, I hope so. I apologize. Yes. Thank you.
No, that's fine. That's fine. Not your fault. It's not your fault. These are some of the challenges that we grapple with on a daily basis.
Absolutely.
Yes,
absolutely.
We've been talking about the response in terms of the global response, but also looking at the lockdown and its implications, which Obi will have to go into. There are several questions coming in, and let me just say, listeners and viewers, listeners on 98.1, as well as viewers on AYV television in Sierra Leone. This program was brought to you by the Open Society Initiative for West Africa, OSIWA, and we are looking at lessons from the Ebola response that would inform our COVID-19 management. So back to you, Yasmin, since you've been out of this conversation. With the lockdowns, with the restrictions, they always come with far-reaching implications for livelihoods, for the rights of citizens. What's your impression of the situation so far in Sierra Leone when you look at rights promotion and protection for ordinary citizens, but especially women, girls, and young persons? But yes, please, Yasmin.
Thank you very much. Yeah, thank you very much, Joe. I think what I'd like to say is that one of the things that I am very much heartened by is that it really seems as if as a country, we have learned a lot of lessons from our Ebola experience, particularly when we are looking at the systems that are being put in place, the protections that are being put in place now to handle the
Good day and welcome to the program Midday Show, where they come to you live from the Society for Radio Democracy, 98.1 FM. And me, they bring come this edition of the program Midday Show come to you. My name na Yeno Kabia. Like all time, we get plenty news, information, and entertainment. So they with me for the next 1 hour. You can be part of the program by way you go send a text message to the number 077 981 981, and say if you can go on our Radio Democracy Facebook page and drop your comments there. Where family members say you be listen to a live broadcast where we see what they do, but the lessons they will be learned from the Ebola response, so that authority themselves go use their lesson there for help for fight the coronavirus where they now in the country. Stay tuned, continue for listening at exact 12:30. We go continue back with Midday Show.
What it is happening now, we can see that definitely in all the communications, efforts are being made to make sure that women are included, are involved, and that the gender perspectives are taken on board. I really think it's excellent that specific attention is being paid to the fact that people have to have water at this time. My one concern perhaps would be that perhaps the Ebola survivors themselves, the Ebola survivors from 2014, 2016, have not been given special attention and have not been the focus of any particular intervention in this. And I think that that is one area in which perhaps it's not too late yet, because they do have special vulnerabilities. They are people with health conditions that make them particularly vulnerable and open to infection with COVID, as we have understood from the work that is going on. What we are being told, the information that we are being told, and I think that it would be excellent if the response would think about how you deal particularly with people who have special conditions that make them especially vulnerable.
Thank you. But also in terms of the judiciary, measures that have been put in place by the judiciary. But thank you for that point about the level of awareness in terms of support for support systems that have been put in place. But it would be helpful to learn about the judiciary, for you to talk about the judiciary a little bit in terms of general rights protection and promotion systems that we have in place at this very important point.
Well, I think that we have to be focused on the fact that at least the courts are always available, even if they had said that they weren't. The criminal sessions or the civil sessions were suspended. By virtue of our Constitution, our courts always have to be available. The judges always have to be available to the citizens to respond to issues that arise during periods of emergency, of states of emergency. So at least the provision is there, and from having taken measures to deal with the very narrow area of people who are in conflict with the law and protecting the rights of people who have to use the courts. I think the judiciary we are expecting is available should there be particular challenges that need to be raised. I think so far we haven't had, in particular dealing with the response itself, dealing with COVID itself, we haven't had particular issues raised where we have seen a failure by the judges to provide the protection that they are required to do.
Great. Since Yasmi, we're having you all now after a couple of minutes. But ladies and gentlemen, we've asked our friends of 98.1 to put together some questions we'll share with the panelists, but also on AYV. I think our friends out there are trying to put together some questions that they will share with us. For those of you that are online on the Blue Jeans portal, we've received a couple of messages. We'll come to those messages very shortly. But Yasmi, a quick one. Here you're at the moment providing some support to the Ebola survivors. What issues, in terms of, when we look at the lessons, in terms of resource allocation, in terms of allegations of mismanagement, what lessons? I mean, this is still a subject of a case in court, the ECOWAS court. What do you think, what can the government and civil society organizations, but the wider public learn, and how do we prevent the same from becoming the next conversation after COVID-19?
Right. I think one of the lessons that we have to learn as a country, as a nation fighting COVID, is that we have to learn from the experience of Ebola that the question of the allocation of resources, making and the most efficient and effective use of the limited resources we have is really, really fundamental. The fact that so many years after the Ebola experience, we see that people are still so aggrieved. People were so much damaged and affected by the question of mismanagement, means that of resources and the whole issue of what happened to the funds, means that we have to, the government, those implementing, need to pay a huge amount of attention. And it is really significant because that is at the heart of what is the national response. Everything else that happened, for good or for bad, during the Ebola, comes down to this issue of what happened to those resources. And it's very important to see now that the public is insisting and calling for, is constantly holding the government and the EOC to account and asking about, are you sure you're doing the right thing with what you have been given? You have to be more transparent. You have to be more accountable. Definitely lessons have been learned, as we can see. Again, some lessons have definitely been learned from the Ebola. We see that the Auditor General, again, was very proactive and upfront in setting out the guidelines and giving directions to the people who have control of the resources. And the Anti-Corruption Commission itself has been very open and has been proactive on this. The Ministry of Finance has been publishing regular updates and giving us a lot more detail and making that accessible to the public on social media as well, and civil society organizations and the general public, which is so important, have been asking questions and demanding accountability. So I think that's what the public has to do, what we all have to do as part of our own very important role in all of this, is to keep asking the questions, to keep shining a light on what is happening to the resources that are available, limited as they are, or generous as they are, and making sure that in real time now we keep asking for explanations, for things to be done, for more explanation for us to know what the money is being spent on. Because we cannot, going back to Ebola, we cannot afford mistakes because mistakes are so costly. We lost so many people, because, and, we have no proper explanation now as to what happened. So definitely, I think that we're in the right path now, I hope, to ensure that we don't have to have this conversation. But I would like to see more proactivity from parliamentarians. They are, after all, our representatives, and they have a very important accountability role. Even if they can't meet in plenary, I believe that the accountability mechanisms, the oversight mechanisms of Parliament should be very active. The committees should be working in real time right now, going to ask questions, checking now. We don't have to wait till everything is finished and then we look back historically and say, oh, this didn't work, this was not available, etc., etc. I think they need to modify their behavior and take advantage also of the current situation to be asking questions now, asking for the books, looking and following up on things.
Right. I think we've made a lot of progress on this because rights promotion and protection is extremely important, but also resource allocation. We definitely don't want to go back to where we were. I hope we're learning lessons. Mr. Minister, I know we're putting you on the spot on this one, but a couple of things have been said here by all the other panelists, but also questions that I'm getting from our platform here. It's clear that communication is key in all of this. Effective communication, but also partnership are key. What measures do we have in place? I know you are the spokesperson, but misinformation is also one of the key challenges that we're grappling with at this moment. Fake news, misinformation, these are key things that you should be on top of. How are we dealing with that in the whole response? And in addition to that, I'm just going to bombard you with a couple because we have about 20 or 25 minutes left, or 25 minutes left to go. But I'll give you another one. In terms of communication, misinformation, disinformation, and its impact on the response, that's one. But two, people have talked about social and physical distancing. How are we dealing with all of those situations in our current context? What is possible? But also, we'll come down to contact tracing and surveillance, but those two are key for us in terms of information, communication. How are we dealing with that? The fake news bit of it and disinformation. Hello?
He needs to unmute himself.
Hello, Mr. Minister, can you unmute, please? Did you get that? Did you get the question? My question. Okay, so I think someone's there to help me out.
Hello, can you hear me?
Yes, I can hear you now.
All right, sorry. Our strategic advisor for public health information just walked in, so Dr. Spencer, so sorry for that interruption. Yes, Obi was speaking to a very important facet of what we do, risk communications. Indeed, risk communications, that aspect is very important, public information. And so for us as a pillar, we operate under the communications and social mobilization pillar. We bear in mind how important risk communication is in terms of building trust, engaging communities, making sure that we provide accurate information in a very timely manner. And I heard his reference to what happened the last time on the death, 5 versus 4, and it was important for us. I think credibility is a defining feature of what we do. We should not take advantage of the fact that because we have an emergency, so protocols and best practices must be subsumed into some unhealthy values and culture. I don't believe in that. So for us, it's very important. And Joe, we will continue to widen and deepen public information and the scope of our outreach. DSTI is working with the EOC. We have a very strong partnership. DSTI is helping us within the framework of technology to ensure that we disseminate our messaging system. And also in terms of fake news, the agency of the Attorney General, the Office of Attorney General, and the National Telecommunications Commission are working hard. And so we saw a drastic reduction in prank calls, for example, because of that strong collaboration that we are enjoying. As official spokesman, I know that it has not been easy to get to the point where we are, but I think that we have put in so much into this to ensure that we have an essentially proper vehicle, credible vehicle of public information and risk communication. So the challenges are still there. Obi was talking about some incoherence, elements of incoherence in messaging. And exactly, I took personal responsibility, for example, with respect to what happened, with respect to the deaths. And I thought that it was unhealthy to put into the public domain what we could attribute that incoherence. I think that was for us to deal with it internally. But it validates the point that when you have a data set and you have a whole agency dealing with data and you have several persons and some persons want to take credit for releasing the information first, and you have the Ministry of Health that has its own Directorate for Health, Security and Emergency, having their own data patterns, and you have the Ministry of Information and Communications having their own data strand, and then you have the situation room. And so for us, it was important for us to establish the protocol that before you could put anything into the public domain, it has to be validated in the situation room. The coordinator has to know about it, and it's validated. And even for WHO, we realized at that point that WHO was also recording figures quite inconsistent with what the EOC was recording, quite inconsistent with what Ministry of Information and Communications was recording. So we have gotten to the point where I think we are now establishing a language from the same playbook. The rule is quite clear because I have emphasized that these have implications for our national image as a country. It also has far and wide-reaching implications for our institutional credibility as well. So there is a semblance of coherence. We are not there yet 100%, but I think we deeply understand that credibility has to be a defining feature of our public health response. And so you also mentioned, what was the other part, Joe?
I think I mentioned the disinformation, but also social distancing and physical distancing, and how are we grappling with all of that? How do we ensure, is this possible? How do we ensure that this happens within our context? Obi talked about it, but even as you drive around, I mean, there was a day I went to the supermarket, I had this mask on, two people were looking at me like some strange animal from nowhere. I mean, so these are all some of the issues, but how do we deal with it? How is it? Are we considering a mandatory bid? I know the private sector there are communities and private sector have stepped up and they're providing some masks around. But is that something that you're considering?
In
mandatory
Africa,
use of masks and so on? Mm-hmm.
In Africa, and specifically for Sierra Leone, it's practically challenging to achieve social distancing. When you look at the slums, when you look at the poor homes, you go to some homes, it's a single room, you have the parents, the father and the mom, and you have 3 children in there. Even when we had the 3 days lockdown, you go to some places, people will have to sit in their verandas because they will tell you that it's extremely hot for them to be inside. So it's practically difficult. I was reading on President Cyril Ramaphosa's measures in South Africa. I think extremely tough measures, but then the downside was when they realized that for the slums and for the poor communities in South Africa, social distancing was a critical challenge. So it's extremely difficult. So what we continue to do is to deepen public education around this for people to understand that when we do social distancing, when we do the hand washing, when we use the face masks, we are not just succeeding in fighting and preventing the spread of coronavirus, but we could also succeed in preventing other diseases as well. There was a short study that was done in the case of Hong Kong, and they realized that after a while, the rate of hospitalization for influenza drastically reduced. So for us, I say to people, at the end of the day, when we would come to reviewing and examining some of the gains that we made, I'm sure that the statistics would show a drastic reduction in hospitalization for malaria, drastic reduction for treatment for malaria and other things. So we are not just fighting COVID-19, and that is what we emphasize anytime we go out there to talk to people, that as you are doing this within the context of our fight against coronavirus, we are also indirectly trying to guard ourselves against the upsurge in other diseases as well. Some of the things that we do, Joe, I think...
Yeah, can you do it quickly so as we round up?
I think there is a strong
there are a couple of questions coming
there
up.
is a strong behavioral and emotional history tied to this as well. You go to some villages, hear the other questions and see what reasonable attempts I could make to them, Joe.
Great. Ladies and gentlemen, as we round up, there are a couple of questions. Yes, please. As we round up, are you done? Because we've got to round up in a couple of minutes, but there are a couple of questions still here for you, Mr. Minister. One of them is people are concerned about the level of coordination between the Ministry of Health and Sanitation and the response team. That's really important. People need to know what level of coordination and collaboration is happening. But what's the level of the involvement of community-based organizations, civil society organizations, that partnership? People are eager to also learn about that. But then what's our strategy as a country to respond to COVID? Have we adopted a herd immunity line? Physical distancing, I think I talked about that. Wearing face masks. Mask wearing is not being followed by public officials. Another question. So I'll read out the questions, ladies and gentlemen. Let me read out the questions quickly so that we can grab them as we round up this conversation in a few minutes, please. Does that work for us all? Yeah, Mr. Minister, there's another question here for you that says, you mentioned other restrictions in place, such as inter-district movement, mandatory wearing of masks, and so on. But that security is being compromised in a way. What has been done to address these lapses from legal and public communications perspective? That's one question. For the EOC, we all saw in other countries a rise in domestic violence during lockdown. Would like to know if there are trends or patterns emerging, and if so, what is the EOC doing to raise awareness and support to women and girls most likely to be impacted by domestic violence? Alimatu also says, for the EOC, we see in other countries. Okay, that's it. I think that's a major thrust of the conversation. Yes, please. But as we note those questions down, Dr. Bell, in terms of the death rate, I think Sierra Leone has hit over 400, and we have about 26 deaths now. I don't know what the death toll is as per today's update. I mean, and we've had 2 lockdowns to facilitate a lot of tracing and so on. We've put in place various measures. I mean, again, concerns have been raised about what is it that we're doing? I mean, what are people presenting, and how are we managing this asymptomatic and symptomatic cases? I think you touched on that earlier on. But broadly, I think those are some of the questions for you, Jamiru. And Obi, as you round up in your final comment that you will make, in the 1 or 2 minutes roundup that you will make, I would like to know what your views are about setting up a separate institution in terms of emergency response for Sierra Leone. So let me start with you, Obi, emergency response institution, what your views are for the establishment of a separate institution instead of having to set up this EOC, which looks a little ad hoc as we respond to epidemics or pandemic in this particular situation.
Ever since Ebola,
so let me start with you.
Starting with me, Joe. Ever since Ebola,
please. We just have
ever since Ebola, I have been pushing for us to have a standing national disaster management agency. It was quite unfortunate that we decided to disband the NAC. I think we should have kept it and slimmed it down. Now, that doesn't remove the need for a public health emergency operations center, which the EOC is. The point of a national disaster management structure is that whenever you have a disaster, if it's a medical disaster, they support the medical authorities. It could be an attack of locusts on our agriculture sector, and then you'd expect your national disaster management agency to support there. It could be a tsunami, it could be an earthquake, it could be a plane crashing on takeoff or landing at Lunge. And so let us not confuse general disaster with health disaster. In any disaster, there will mostly be a lead technical government department: agriculture, education, infrastructure, in this case, health. But you need a national disaster management structure to support this. Listen, you can learn how to sequence the DNA of Corona or Ebola at Johns Hopkins Medical School, but you won't learn how to quarantine an entire district. So the brain and the muscle have to be there in these responses. The lead ministry, the technical ministry, the Ministry of Health, they are the experts in what we should be doing. But you need a command and control structure that runs logistics and efficiency to make sure that things that are supposed to happen. Can somebody really assure me that all of the healthcare workers have been trained? Can somebody really assure me that all of them have the gloves and PPEs they need? Can somebody really assure me that all of those places have isolation capabilities? You need somebody checking on these things, because in our experience, what we learned during Ebola, people said things were done, and we found out they weren't done, and that cost lives. Thanks.
Okay. Quickly, Mr. Minister, questions are being raised. We've got lots of questions about quarantine facilities, about the quality of the care out there, and it's not changing, but it's also about the cost of all of these. So, Minister, questions are being asked about the quality of the quarantine facilities. What's happening? People are concerned about security, financial resources, and so on. What are we doing to address that particular situation?
Thank you, Joe. Quickly on quarantines, I put out something on social media platforms recently on quarantines, and the question I asked was, to what extent are we willing to accommodate this, bearing in mind the socioeconomic implications? Every now and again in our meetings, quarantine issues come up on radio, on television, on social media. There are incessant concerns about quarantines. And when I came here, in the very first week I was here, I already said I think that we may stand or fall based on our management of quarantines. And I think that is what our assessment is speaking to. So it's a minefield we have to look at. And there are discussions that if it gets to the point where
who is taking responsibility of some of these lapses here and there? I think someone has to take leadership on these, because the surveillance and quarantine are key to our response. If we don't get it right, that's in addition to the communication and other bit. If we don't get those right also, we're going to continue to wallow in this scourge.
Yeah, so in terms of structure dealing with quarantines, the decision has been taken at the highest level, and this is being looked into, and we believe that the new leadership could inspire some changes in the right direction that will be reassuring to the general public. And you were talking about what is the strategy in dealing with this disease, and I think it's a combination of mitigation and suppression. We continue to take our mitigation measures, and we'll continue to do suppression for as long as they are necessary. And I will assure you, Joe, there is very strong collaboration between the Ministry of Health and Sanitation and the EOC. As a matter of fact, that ministry is significantly represented here in all facets. They're represented in the data set of what we do. We are also working with them within the framework of our national One Health policy, One Health response. And so there is strong collaboration. I started off in my introductory by saying that before coronavirus came to Sierra Leone, we have been utilizing the mechanisms of our interministerial and partners coordinating unit. So there's very strong collaboration between EOC and relevant ministries. And going beyond Ministry of Health and Sanitation, local government is another one, because we understand that local councils will constitute a critical part of the operations and very much complementary in our emergency response. So yes, the challenges are there. But let me just wrap up with this, Joe. Whatever we are doing within the framework of what is available, within the framework of what defines our current status of our health system. With a health workforce, 1.4 doctors, nurses, and midwives per 10,000 population, I think we still have a shortfall of 32,000 if we should go by the baseline set by the SDGs, which is 44.5. So we are responding to this pandemic within the framework of what is available. And that is why quarantines are being affected as well. Because you look at our fiscal pause, look at what is happening. Before coronavirus, our daily revenue mobilization was about 22.7 billion. Now it's down to about 19 point something. Monthly was about 468 billion leons. Now it's about 365 billion. So all that will bring their socio-economic implications as well. But within the little that we have, I think we continue to do what we're supposed to do, and we continue to count on partners like you, Osiwa, supporting Carl in promoting human rights and fiscal accountability, supporting 98.1 for our public education and communications, supporting us with respect to mobile telephony and messaging system. So we know that like every
You're on mute, Joe. You're on mute.
Sorry, I was just saying, we have the Deputy Minister, the COVID spokesperson back. Can you round up quickly, just 1 minute, and have Dr. Bell to also give our final remarks in Yasmin and Obi, please. We're way behind schedule now, just taking care of the time that we lost with Yasmin away.
And so I was saying, given the paucity of the resources available to handle, to address this and to break the chain of transmission, we are saying that we feel very comforted that partners like you and others have been complementing us substantially, and because of the massive socioeconomic implications. And that's why we continue to talk about flattening the curve, and also meaning that we have to prevent, we have to take the precautionary measures so we don't get to the point where for quarantines, for example, we could no longer manage them. We don't get to the point where we have a lot of admissions at treatment centers and we don't have the capacity to deal with them. So I was saying that given the paucity of the resources that we have and given how weak our healthcare system is, it is important that our people continue to take the precautionary measures, washing of hands, using our face masks, and maintaining social distancing, and so that we are able to manage this in good time.
Great. Dr. Bell, I know we've received a couple of ventilators or oxygen concentrators and so on. Do we have sufficient? Do we have enough to help us respond to these challenges? I know we're losing people, so it will be helpful to hear. I mean, when we look at the statistics across the globe, I mean, the number of deaths that we've had, looking at the recovery rates in Guinea and Senegal, friends in the neighborhood. So can you speak to those quickly, please, as you round up in addition to any other points you might have to raise quickly? Dr. Bell, can you unmute, please?
Okay, I'm unmuted now. Right. Can you hear me now? Okay. So yes, in terms of statistics, you were talking about the case fatality rate in Sierra Leone being higher than other countries in the region. We have to carefully analyze these data and accept the data.
This is just from a layman's perspective. This is what people are saying. Why are we losing so many people? I mean, this goes for Jamira and others. This is the ordinary Sierra Leone. These are concerns. Our ventilators, oxygen concentrators. Do we have enough? What's happening? What are we doing to help prevent all of this? How responsive are we?
Yes, so I had the question. So the answer to that was we have to carefully analyze the statistics from other countries in terms of the deaths. In Sierra Leone, for instance, the deaths include deaths that happen in the CTUs and also outside of the CTUs in other hospitals. Some countries don't count the deaths that are happening outside of CTUs. Now, 50% of the deaths that have occurred have occurred in CTUs. The other 50% have occurred outside of the CTUs. So we have to carefully analyze the statistics from other countries. Also, in terms of positive cases, we have to be cautious when comparing statistics, because I know that some countries, especially in Africa, are not tested as much as we are testing. And obviously, if you're not testing, you're not going to have positive results. So we have to carefully analyze the statistics from other countries. And as I mentioned, only 50% have actually happened in the CTU, what people are counting out there. But we are counting everybody. In terms of ventilator and other sophisticated equipment, we do have a few more that have been brought into the country. And one good thing we're taking away from all of this is that a whole number of healthcare workers have been trained on using ventilators. But guess what? We don't have any ventilated patients at the moment as we speak. In general, the system is not perfect. No system is perfect. We see what's going on in America. And the system in Sierra Leone at the moment, including POC, is not perfect. The training I was talking about, yes, we had some trainings, but some of them didn't cascade down to the other healthcare workers in the other hospitals. Some hospitals could not send their representatives. Some private hospitals are not registered in the Medical and Dental Council of Sierra Leone, so they did not get the training because they couldn't reach them. So the system is not perfect. However, being a part of the stage group, I know and advising the presidential task force and the larger picture, and also being a part of the case management, I know that the surveillance quarantine and lab are coming up with some more ideas to further collaborate and to further manage the quarantine homes and other isolation centers in a better way, so that we don't get overwhelmed. Because feeding all of these people in the quarantine homes is a burden. It's taking funds away from where we're actually supposed to be putting them, and we don't have a high percentage of positive cases coming from these quarantine homes as you would expect. So they're putting something together. I cannot spill the beans here, but something is being put together in terms of how we can manage this large number of quarantine homes, but make sure that we all stay safe and the quarantine homes don't keep infecting themselves inside of the homes. So the takeaway message is, no system is perfect. Definitely the system in Sierra Leone is not perfect. They're working, however, towards making things happen as they're supposed to happen, international standard, at the international standard. And we're working together, not just the case management, but SLMDA, the Sierra Leone Medical and Dental Association, the West African College of Physicians, all working together with the EOC, with the Ministry of Health in combating this disease.
Great, super. Thank you so much for that. Obi?
Yes, Joe, thank you. For me, to round up is we need to realize that this is an existential threat to our country. A lot of the lessons that we're learning today around coordination, around public communications, around engaging people in the community, around keeping on top of quarantines, these are lessons we learned before. So for me, it's a bit disappointing to see that we're relearning these lessons again. We're not starting where we stopped, we're starting where we started. And that's very disappointing, and I really hope that as we go along, and we have some good people in the response, the minister is communicating extremely well. We hope that we address some of these failures and we correct them very quickly. Sierra Leone should be a poster child for fighting corona, even though we don't have money, because of our experience. We should know better. Fighting a virus is like fetching water with a basket. But the thing is, you need 100%. If you find 9 out of 10 contacts and you miss one, then you still have a potential epidemic on your hands. The biggest problem we have with fighting a virus in Sierra Leone is our general tendency during normal times. We don't like to bring up problems. We like to say this is done, because we don't want to look bad to say it's not done. We like to say that's done, this is done. Is it okay? Yes, it's under control. It's all done. The thing with a viral response is 99% is a fail. 80% is a fail. If you don't get 100, you are not getting it right. The one nurse that is not trained is the one that could get infected, that could spread it in the hospital. The quality of the responses would be my parting point. The quality of the response. Anything that's supposed to be done, should be checked, should be verified to make sure it's done to 100%. We ended up in a mess in Ebola because we kept assuming we had done things, and we hadn't. Thank you.
Obi, I can't thank you enough for that parting note. Yasmin?
I'm listening to everybody.
It will be good to hear about your relationship, your final notes, please, your relationship also with the Ebola survivors, what lessons we can draw from those, but also in terms of right protection, response systems, protection systems for our women and girls at this crucial point when people are home, sometimes in lockdowns.
Yes, I think that the fact that we are aware of the that there is a potential problem happening in the lockdown, the need that over the years we are very much aware that we have a sexual and gender-based violence problem and that we need to be responsive. The fact that the Family Support Unit has been quite proactive in its response to complaints coming to them of the police, the Family Support Unit was responsive, I think is a very good sign. We have to just up the communication and the teaching to our public to say, to the women especially, to say that you don't have to accept violence. You have a right to be protected. It is the job of the government to protect you. So contact the police, step out, ring the 117 if you have an issue of violence. It's not only if you're sick because you've got a temperature or the other issues, the COVID symptoms. If you are suffering in your house because you are being physically or emotionally abused, then you have to seek help, and you will get help if you reach out for it. My parting comment would be in relation to the looking at the relationship with the survivors, especially the Ebola survivors, is for all of us to remember that surviving is a heroic act itself. It's a big thing, and our survivors are resources. I'd really invite the authorities who are leading us in this fight not to forget to tap into that resource. It's a terrible thing to say, but we need to remember that we have had an experience in this country, and we have people who have come through survived and recovered from the pandemic, and the treatment, who can give very valuable insights. And I really hope that the authorities will, Mr. Jamiru and others will make sure that they bring them on board. I think if we were to have some of these messages as ordinary members of the public who've never been affected, if we were to get some of these messages from the mouths of the survivors, then it would carry a lot of weight with the public. I think, to have gone through this and have survived it and to still be standing is a testimony which I think can help to address the problems as they emerge, but also to give us, those who are, crafting the response, some insight as to how to do things better.
Very grateful for that response. I must end, Mr. Minister, one of the things that people have said, I must echo the comments across the board, that people appreciate your honesty, the fact that you owned up to the mistake that was made, and that's really what a true leader is supposed to do. You've got to be honest when you make mistakes, and we learn from them. Thank you very much for that. But before we go, Mr. Minister, one last point is that people are still concerned about management of financial resources and how service providers, how procurement is being done, and the whole COVID-19 response. I think we need to learn lessons from that. The government needs to learn lessons from that. Let us put in place the right measures. It would be good to hear maybe just one word before I close, Mr. Minister, on that. Management of financial resources and the procurement and what are you doing to abide, to just follow all of the stringent fiscal accountability systems?
Thank you, Joe. So quickly, I know you are supporting Center for Accountability and Rule of Law on promoting human rights and fiscal accountability. Just 48 hours ago, we met with a team from the Auditor General's office. drawing our attention to some of the discrepancies that might have defined the Ebola context and how we should not go down that route. We are pretty much mindful about those ones. And I would also say government had set up two accounts into which government had made a contribution and also inviting partners to make contributions. Whatever we do in expending funds, we do so within the framework of the public financial management system. We know that there are procurement areas to look at as well. We know that within emergencies, for example, you could do sole sourcing, but even when you do sole sourcing, there are defined parameters. So yes, there are principles, practices, and values that we are jealously guarding to ensure that whatever we do them judiciously, and we don't take advantage of the fact that we are having emergencies and get very important practices and values submerged into emergencies. So we bear that in mind, and we know that we are accountable to the people. We know that we owe the people the fact that we have to provide material information in a timely manner. We know that it is important for us to deepen public education around COVID. And as Yasmin has said, Yasmin, I have had discussions with some of the people who have recovered and were discharged from the treatment facilities, persons who are willing to share their story. I've had discussions with Dr. Nelly Bell, a fantastic story she told, and we're going to put some of those into the public domain, because when we make public information evidence-based as well, it helps us to deepen and widen public information. So we have taken all of those on board, and we will continue to push the boundaries.
Great. On that note, ladies and gentlemen, this has been a very instructive conversation that took us through the journey of the Ebola experience, preparedness, response, as well as plans for post-COVID-19. The fact that epidemics and pandemics also come with accompanying tough choices has also been an issue of today's conversation, with human rights the focus, as well as socioeconomic rights, but also looked at some of the ramifications of the steps that the government has taken to respond to this scourge. As an institution, the Open Society Initiative for West Africa, OSIWA, has provided 4 grants to Radio Democracy to continue the public information work in partnership with a couple of other radio stations. The second grant is to Center for Accountability and Rule of Law to monitor human rights, protection and promotion across the country. The third is to Fix Solutions. That's the local IT company that has been working with both the correctional services as well as the Sierra Leone police and on credible data management. And if we have information today on the number of inmates that we had in this country, I think the government of Sierra Leone has got to be grateful to OSIWA for that. We supported Fix Solutions to provide that system for the correctional services. And we also have developed a text messaging system, so we'll be working with the EOC to push out messages from time to time. But in addition to that, we'll be working with a couple of organizations that have applied. We don't have a lot of money. We only have a small pot of funds, but we'll support some community awareness initiatives. And in the very near future, discussions with the EOC, and in particular case management pillar, I'm sure the government and people of Sierra Leone will hear from us about our solidarity support to Sierra Leone in the COVID-19 response. I want to thank AYV Media Empire, as well as Radio Democracy, very, very much. It's been wonderful. It's been great reaching out to people. We're in this business together. Communication is key. And the only way we're going to get it right is by being honest, by being frank, by being brutal in what we say out there. That's the only way we're going to get it right. Let's come together, support communities as best as possible. Those of us living in our communities, let's support people around us, provide masks, provide buckets. Those of us that can afford it, provide a few bags of rice or a few cups of rice whenever there is a lockdown to support the vulnerable people in our communities. Thank you so much, and God bless Sierra Leone. I hope we all take this forward. We're going to compile the major recommendations from this conversation, present them to the EOC, and hopefully they'll get to the chief executive of this country. God bless us all. Thank you.
Well, that's not special live broadcast where see what they do, outside them be engage different partner them and save governments been there, outside them be they talk about the lessons the way they learn from the Ebola we been passed now the country and save make government go pick part some of them thing then they for implement some part the corona effect where they now na the country. The program they show they continue and we they look at the first issue. Because of the way and manner how violence done they happen at the country, make different people and organization them done they pull press release. Also they don't they condemn them violence they are. And one pande organization they are, we don't condemn them violence we keep happen at the country. Now the Interreligious Council, also one member na the Interreligious Council, Sheikh Ali Kale say, now the politician them can use young people them focus the plenty political violence we keep happen at the country. Sheikh Ali talked to Chelno Jalo inside this interview.
And to the extent that there's a release, in a press release, condemning instability, condemning violence altogether, all form of violence, whether it is domestic violence, street violence, political violence, color violence, tribal violence, are all condemned by the council. Well, NAPO advised everybody without taking sides, okay, without pointing finger at anybody, but for the general benefit of all of us, violence, will carry go no side. And as we've been asked, political violence, especially the last couple of months. Why make violence? Now, because the politicians that they use people, then they exploit the ignorance of the people. They no say the youth that they not get nothing for do. He hear a small thing, he get that they let them go suicide, let them go cause mayhem. They're ready. Even individuals, honorables, ministers, then gang them.
So most of the time, we don't see this when they happen in Intelligence Council on the press release for condemn the act. Aside from press release, what are some of the other things they are going to do for sure? Say, wanna see our best man will tackle.
Well, the other measures they will take. But if you said they see, we get programmed in our television and all radio stations there. We will go talk to people about this COVID-19, and they also talk about violence in our individual congregations, in our individual programs, without pointing finger at anybody.
Clear say we are Intelligence Council, we get large congregation will follow now. Like can it imam say the winter. Now this my pastor say the winter. How do they engage on our members in the community then?
Actually, not to be members then, we get problem.
Locally, for me to see locally.
In fact, now we normal practice that. I also want to say promote virtues. Always discourage vices. When I cooperate in development, when I cooperate, when I work together in progress, then when I not connive with each other for do bad, and then the vices that vary. But what happen in our country, we own a political divide. Some people that can say tribal or regional, but me I can put also. But waiting on Mornin Salone now the political colors. The person committed to a political party pass a religion. We say people that come on the street past month they burn tire, pass the paper fast. Now, like them two places the way we get there Guskas. Go na chief he goes take cutlass, chop person, kill a small picky for that matter. He will go check. He get for do something with political parties.
What in the religious council body thinks it need for be done for address some of the issue there?
Now the parties and business will for put aside. Political party no mean nothing. Especially to you, the illiterate. Okay, after politics, go do something. Learn. When I for no see them politicians, they're not sincere. Then they say when I for go do bad, they're not the same they don't picking them for go do bad. They don't picking the England, in America, in France, they study. Then you they also they suffer.
So we don't see them so just now. Apart from the press release, when I condemn the violence will take place in the country. When I get a plan for me to some of them.
If there's a call for that, we are ready. We are ready to do so.
I don't make any moves like for engagement.
The politicians.
Yes, from these things that
we don't do on several occasions.
What's that response?
They will talk to you fine, all things are okay, but they're not ready for that. Nobody know the personal politics today. We don't get certain youth the way they prepare, right, for defender one day. That is the system now. So the politicians, the people they wait for, be careful with. Alhamdulillah, like their party are democracy day. But that's not the way democracy is. There are scholars in jail because then they tell the government the truth.
Well, in a one member na the Interreligious Council, Sheikh Ali Kalibi, they talk to Cheikh Nojalo inside that interview day. Also, and say the plenty political violence we don't happen among young people in the country, na politicians then can cause them. When I had this edition of the program midday show for today, Tuesday, May 14, 2020, go left you. Plenty thank you to my producer Alex Lawrence Kuroma and my executive producer Michael Sambula. And thank you to the technical team, Moses Kavura and DJ Sugarcane for the technical support. So till we meet again, Mena you know Kabi how they left you for this edition of the program. Tata.